Appreciate it. Thank you, Mr. Chairman.
Senator Ricketts, thank you, and we'll turn next to Senator Warnock.
Thank you so very much, Chair Casey. I would be remiss in this moment if I didn't just take a moment to remember the legacy of the late First Lady, Rosalynn Carter, whom I was privileged to know and whose mission was to center and uplift our caregivers. Her extraordinary work demonstrates how a healthcare system that leaves so many drowning in caregiving costs most of us will one day face, is a healthcare system that falls short of its basic obligations. Dr. Morgan, in your experience as a gerontologist, how does the cost of assisted living burden seniors, their caregivers, and their families?
Well, the cost of assisted living is both financial and emotional and real for many Americans. We have a system where there's not access to assisted living. In some states, there are Medicare waivers that cover a larger portion of those who need it at the lower income. But there are also states that have virtually no waiver programs, so that the only people that can afford assisted living are those who have those significant financial resources. And so the middle tier of America tends to do things that I talked about in my testimony. They reduce their working hours. They set up these arrangements across families to pay for assisted living if that's what they can do. They bring in people who may not be trained to support their person living at home. They make these precarious work and family arrangements to be able to make it through whatever long-term care they have for their loved one. If they're lucky enough to get into assisted living, then they're still coming after work, and they're still bringing the incontinence supplies, and they're still bringing the snacks and engaging the residents. And it's another job on top of the job that they're trying to do if they're still working, if they're still able to work. And that is really important in young onset dementia as well, because in young onset dementia, these people are still earning, right? And they have young onset dementia, and then the families have very few options for thinking about their forward retirement, right? Retirement isn't what we end up doing. We end up mortgaging everything to do the care and to clean out our savings in order to support this person living with dementia who may not be able to be at home. A lot of the young onset dementias have the sorts of things that Patty was talking about with Lewy body dementia and frontotemporal dementia. We have a different course of the disease, and it's really difficult for people to care for those folks at home. And so even if they're able to afford assisted living for a time, they run out of resources. And then what do? And sometimes they can get into nursing home placement, and sometimes there's good nursing homes to go to, but not always. It's awfully precarious for many folks.
Well, thank you. Your experience with this underscores the ways in which this costs not only the families, but all of us. It has implications for our workforce and our economy, so we have to have long-range, comprehensive thinking about this. The chair has been a leader in this, and I'm happy to join him. I was happy in joining him to ask at the GAO, look into how federal health care affordability programs like Medicaid and Medicare, which you mentioned, interact with assisted living facilities, how we can do better there. And whether families choose an assisted living facility or in-home care, they need help meeting caregiving costs. The average cost of $4,500 a month, that's average cost. But you rightly point out the ways in which, for example, with early onset dementia, people's retirement funds are actually drained, just taking care of the individual. And so that's why I support efforts to lower caregiving costs for aging adults. It's a critical issue for our country. And I'll continue to work with my colleagues on this committee, informed by the expertise of people like all the folks on our panel, to improve access to long-term care for families across Georgia and across the country. Thank you so much for your work in this area.
Thank you.
Senator Warnock, thanks very much for your questions, and we'll now move a little bit out of order. We'll move to a second round as we're waiting for senators to ask their first round questions, some of whom are on their way. But I'll start, and I know Ranking Member Braun has some questions as well. Dr. Morgan,